today?
Hi, Ms. Thompson. I'm interested in hearing more about this.
Thank you. There's a copy of the brief that I'm going to present to you today. This brief is about safe staffing in New Mexico, Senate Bill 514. And what it does is it establishes safe nurse-to-patient ratios to increase patient outcomes, nurse satisfaction, and decrease mortality at bedside. This legislated nurse-to-patient ratio include accountability for patient acuity, patient variability, including the number of admissions, discharges, and transfers that occur per shift. It takes into account patient turnover, available technology, and ancillary staff to take care of the patient at the bedside.
How will these ratios be established?
The ratios are going to be established by a committee that's composed of at least 75% of direct bedside care nurses and 3 other staff that will be appointed by the hospital.
How will compliance be measured?
The compliance of this initiative will be measured by reporting to a public website monitored by the Department of Health to make sure that the compliance is adhered to, and the hospital or organization will be subject to fines if not complied.
Any other clauses?
Yes, there are 2 other clauses. The first of which is the right of the nurse to refuse her assignment if she feels that it's not necessary or that it's not safe, so that it can be reassigned. The second portion of that is that the whistleblower clause protects the nurse from retribution should she report noncompliance or safety issues. Let me give you a few of the positive side of this initiative. Mortality is increased by 7% when nurse staffing ratios are not adhered to. It's associated with poor patient outcomes to include UTIs, pneumonia, and cardiac arrest. Increased nurse turnover costs $300,000 per year per percentage point that is not adhered to for patient-staff ratios.
Those are impressive numbers.
Thank you. I hope that you'll back this initiative for us and get it passed through the legislature so that patients can receive quality care. What do you think our nurses can do to advance this initiative?
Have your nurses contact their legislator via email.
That's a good point. And I hope to follow up with you as this initiative advances so that we can see this bill through. Thank you so much for your time today for this initiative, and I look to hear from you soon.
Yes.
Thank you.